Hello, I am Hwabok-jae. The title of the study to be presented is What about the psychological trauma experiences of psychiatric nurses? Feminist Phenomenological Study. The table of contents is as follows. It consists of introduction, research methods, results, conclusions, significance of the study, and references. The first is the introduction. It consists of two parts, the necessity of the study and the purpose of the study. Psychiatric nurses can experience psychological trauma in special nursing situations caused by mental illness. A special nursing situation here means dealing with problems that often occur in mental health facilities such as aggressive changes in patients or their refusal to be admitted. Psychological trauma is the experience of a mental wound that is outside the normal range for the traumatic events, which can cause psychological and physical pain to the person but can also lead to growth through adaptive changes. Therefore, it is necessary to understand the psychological trauma experiences of psychiatric nurses as they are. Feminist hermeneutic phenomenology reveals people's lives as they are with a focus on insightful discovery and interpretation. In addition, it is effective in revealing the essence of the experience and understanding its various meanings based on the people's language and culture. Thus, the purpose of this research, which is the author's doctoral dissertation, is to explore the psychological trauma experiences of psychiatric nurses by applying Van Manen's hermeneutic phenomenology and to understand the essence of those experiences. The next part is the research method. It consists of three parts: research design, participants, data collection and analysis, and research quality. This study is a qualitative research that applied Van Manen's hermeneutic phenomenology, and the participants were 10 psychiatric nurses who had both work experience in mental health facilities and experience of psychological trauma. This study was conducted according to Van Manen's hermeneutic phenomenological research process as follows. The author collected data through individual in-depth interviews and conducted existential exploration by examining idioms, literary works, and works of art. After that, themes and sub-themes were derived through hermeneutic phenomenological reflection, and finally, hermeneutic phenomenological writing was done. In order to secure the quality of the research, the author tried to use heuristic questions and to apply the richness of the narrative, the interpretive depth, the distinctive rigor, and the strong and addressive meaning according to the evaluation criteria of Van Manen's phenomenological research. The next part is the research results. In this study, 5 themes and 19 sub-themes were derived as psychological trauma experiences of psychiatric nurses. The 5 themes were deeply wounded by shock, looking back at oneself with a broken heart, looking around in fear, trying to deal with the wounds and accepting them, and adapting over difficulties and moving forward. The next part is the conclusions. Psychiatric nurses tried to reflect on themselves, overcome their wounds, look at their surroundings with a warm and positive perspective, and accept the experiences as part of their lives, even though the psychological trauma experiences were traumatic, intense, and chaotic to them. The next part is the significance of the study. This study is significant in terms of nursing research in that it applies a research topic that has not been previously addressed to the research subject. It is also meaningful in terms of nursing education in that it provides basic data and the need for education related to psychological trauma for psychiatric nurses. Lastly, it is meaningful in terms of nursing practice in that it suggests the need to improve the awareness of psychiatric nurses' psychological trauma in the clinical field and to prepare a preventive and coping plan. The last part is a list of references. This concludes the presentation. Thank you for listening to the end.